Thank you for joining me, Cristina. It's a pleasure to have you, and I think there's a lot of work you've done that I wanted to discuss, especially about nanoparticles and that work in cancer. But yeah, so thank you for joining me. Let's start off with your PhD. I think that's a good place to start.
Okay. Yeah.
If you just give me an overview of kind of when you started your PhD and what kind of the general topics are, and then how you've kind of ended up to where you are now, and then we can get a bit more sort of into the nitty-gritties of your research a little bit later on. I think that'd be quite nice.
Okay, yeah, thank you so much. So I started my PhD back in 2019. I know that I loved pharmaceutical technology, so I knew that I wanted to do something, regarding that topic. And nanoparticles also, because during my degree, I did a degree in pharmacy and nutrition. So I really like all those field of nanoparticles, cancer related. So yeah, when I joined the department that I was in pharmaceutical sciences in the University of Navarra in Pamplona, my supervisor proposed me that why not tackle just nanoparticles and cancer, but how to deal about monoclonal antibodies and the oral delivery. So I found like a new path opens to me at that time, and it was really interesting. So when we initiate in that journey, it was a little bit frustrating, let's say, because always when you start a PhD, it's not easy, and you have to deal with a lot of frustration. And but I knew it that oral delivery and therapeutic proteins is something that really rings my bell. That it's something that I really like it. So I follow that path, but also wanted to focus on tumor accumulation, how to increase the capabilities of monoclonal antibody in the tumor site. Also, I followed that path during my PhD. And after when everything is coming to an end, I asked the question, what I wanted to do and what I wanted to be. And I really like academia. So I thought that fulfill a postdoc was the right thing for me. So I decided to come to Belgium because there was a group that I really like it, is under the supervision of Professor Anna Belocchi. And she was also researching in oral drug delivery. And I think that it was the time to be more focused now in nanoparticles, oral delivery, and also therapeutic proteins and peptides. So yes, now I'm here after 2 years of my postdoc.
The first paper I read of yours
Yeah.
was based off of looking at sort of mucopermeation as well as permeation through the epithelial barrier to get nanoparticles through, especially looking at bevacizumab, the monoclonal antibody. So
Yeah.
how did that research come about? Was it sort of your idea, or was it something that was already pre-populated? Yeah.
So in my previous group, they were focused, and they are in protein nanoparticles, protein-based nanoparticles, with an encapsulating all over different type of drugs, also protein-based therapeutic drugs like monoclonal antibodies, but also other type of drugs. So when I started, there was a PhD before me, a PhD student, that she was just focused on encapsulating bevacizumab as a model of monoclonal antibody for tumor accumulation, but intravenous administration. So the oral route at that time, it wasn't explored at all. So when I came there, my supervisor wasn't my idea. My supervisor proposed me to start digging a little bit more in this, in this important route of administration, let's say, because we knew now that peptides and therapeutic proteins are increasing in the market. Now we have the pharmaceutical industry offer us new alternatives that we know that they are really specialized, they are really specific, but there are some drawbacks of them The first one is that we have to administer by the intravenous route, parenteral, intravenous, submucosa, different types, subcutaneous, sorry. We have different type of administration, but we are not focused on the oral route. And we know that this type of therapeutic proteins are going to increase for treating different diseases such as metabolic disorders, cancer, immunological disorders, also infections. So we have to tackle because it's going to be a problem. We can't have all the patients in a hospital setting to receive that treatment. So we need an alternative. So that's why we were focusing on the oral route as an alternative to the parenteral route.
Okay, that makes sense. So it was a way of you kind of looking into the future as well and seeing where things are going.
That's it.
And you're trying to plan ahead. I think it's quite sensible because a lot of treatment is moving towards monoclonal antibodies already.
Yeah.
Whether it's asthma or rheumatoid arthritis or cancer.
Awesome. Yeah.
Yeah. So the kind of center of your work, or the center of that paper, which I'll put a screenshot of it up on the screen, was looking at albumin-based nanoparticles, right?
Yes.
What is an albumin nanoparticle? So what is it at its most fundamental level?
So at fundamental level, it's a kind of nanopart. So nanoparticles can be the most known ones are probably the lipid ones. No, we have some nanoparticles in the market that are lipids, but protein nanoparticles are a thing also. So it's a nanoparticle that could go around 10 nanometers to 200 to 250 nanometers, let's say. There are other researchers that you can just have a nanoparticle until 1000 nanometer, but normally on the research area, we have that type of sizes. A nanoparticle, a polymeric a protein nanoparticle, human-based nanoparticle, are a kind of polymeric nanoparticle also. The gold standard of polymeric nanoparticles are PLGA, polylactic glycolic acid. These type of nanoparticles are really unique, let's say, because they form, it's like a fractal. So we are not going to have like an encapsulation, like a capsule that you have the drug inside, and after you have a covering or a coated. It's a fractal that albumin nanoparticle per se, the molecule, that it's a 3D molecule, it's going to attach the drug or whatever you add it to the formulation, and it's going to create like groups, tiny groups, subunits that are going to assemble, and they will form the nanoparticle per se. So it's a kind of fractal system.
Okay, so you've got sort of pieces of albumin that are stuck together, and then the drug is coated on the outside.
That's depend on how you formulate the nanoparticles, how you do the fabrication of the nanoparticles. Yeah.
Okay, so it could be sort of on the inside, sort of intertwined, or it could be on. Okay, that makes sense. Because when you think of like traditional nanoparticles, like whether it's liposomes or micelles, it's always sort of something's encapsulated.
Yes, encapsulated.
Okay, that makes sense. So it's like that's something I was interested about, because most of the things when you see like liposomes, they're very common. So you see them all the time, but
yes.
And then there's all sorts of images with TEM where you can see things, but okay, that makes sense. What is the stability like of these nanoparticles, albumin? Because one of the things with liposomes and lipid-based is stability is an issue. So how do these sort of compare, do you think?
Also an issue. It's an issue, and we struggle a lot in the formation of nanoparticles. I mean, it's an issue, let's say, because we don't want it to use cross-linkers. And so the cross-linkers that you can use to form human albumin nanoparticles, the gold standard is to use glutaraldehyde. But the problem of glutaraldehyde is that it's really toxic. It's not toxic just for the patient, but it could also affect the stability of the drug that you are, let's say, encapsulating on the nanoparticle. Okay, so we wanted to create also alternative to this cross-linker. There are other alternatives that you can just formulate the nanoparticles and you can add it glucose, and after the glucose it's added to the albumin nanoparticles, you can irradiate with UV, and you formulate and you increase the stability of the nanoparticles. In our case, we didn't want it to use neither of the strategies. So in our case, we are playing with the pH close to the isoelectric point of the human serum albumin, and also with the coatings. In this case, the coatings are helping us to give stability to our system, because the problem with albumin is that albumin is really soluble in water. So when we are formulating, we have big issues.
Okay. And when you say coatings, what type of coatings do you mean?
So in this case, I've worked with polyethylene glycol, but also with dextran. We wanted to use also coatings that are generally recognized as safe by the different agencies, medicine agencies like the FDA or the EMEA, in the case of European agencies. So we wanted to be in line with them to use non-toxic, let's say, polymeric or molecules.
In this paper, in particular, the first one that I was going to speak about, you mentioned
Yes.
there's two missions you essentially had. If correct me if I'm wrong.
Yeah.
What one was getting through the mucus, and the other one was getting through the epithelium. What were your strategies, or what was your plan to kind of take these challenges on? How would you do that?
So, first, I would like to say that therapeutic proteins, monoclonal antibodies, and oral route, it's almost, let's say, impossible. Why? Because we have the gastrointestinal tract. We have first the pH that we have are really, we start in the stomach with pH of 1, 2, which means that our proteins, also the nanoparticle and the monoclonal antibody, are going to be degraded. So there is a lot of instability in the gastrointestinal tract to achieve and to arrive to the intestinal epithelium. Also, we have that mucus barrier. The mucus barrier is something really important for us because we need to also to arrive to the epithelium. So that layer of mucus we have to really understand first to know how to tackle that, how to do our nanoparticles diffusive to that layer to arrive to the intestinal epithelium. And after the last barrier that we will encounter, it would be the intestinal epithelium. So that cells that are forming in this case, I would say the small intestine, because we have a greater absorption. So most of our nanoparticles or our systems are going to be absorbed in the small intestine. And we'll have to also understand which strategy we wanted to follow in order to, or first, just do an absorption of the nanoparticles, or just the monoclonal antibody. So the problem with the monoclonal antibody also is the size. We're talking about sizes of 145 kilodaltons. So it's a huge molecule to be directly or indirectly absorbed in the epithelial intestine. Okay, so in the enterocyte. So we have to deal with that. So after reading a lot, we came with different strategies. For the mucus, in case of the mucus, we know that the PEG, the polyethylene glycol, has mucus permeating properties. So we just focus on study how that PEG can enhance the arrival of our nanoparticles to the epithelium. And in the case of reaching the intestinal and to be absorbed, we were thinking on other alternatives that will increase the absorption in our case of the monoclonal antibody. So we will using different alternatives. In this case, we were using permeation enhancers to increase the absorption by the paracellular pathway. That means that between the enterocytes, we have the tight junctions, and we can open those tight junctions to make those monoclonal antibodies pass through and be absorbed by the systemic circulation.
Okay, so there were two different barriers essentially that you're trying to overcome, and
Yes.
that's why you kind of had a dual mechanism
Yeah.
to overcome those. So the peg, I think you mentioned, was something that you picked because it was, something generally regarded as safe. And then you mentioned this formation of a complex.
Yes.
So what is this complex, and how did you form it, but also how did you pick the things you wanted to complex with it?
So in the case of the complexes, also we were looking for a double strategy, because forming these ion pairing complexes, that means that we are not doing any covalent pairing. And this type of complexes in the literature are well studied. And first, these complexes can increase the stability of proteins. So we can also increase the stability through the gastrointestinal tract of our complexes. Not just the stability, but also this type of complexes gives protection to the monoclonal antibody. And our dual strategy was which type of counter ion we were using to form this type of complexes in order to have also a second function. In this case, we chose a sodium docosate, that is a surfactant. Also, it's commercialized and normally is used in under the counter for constipation. So it's a common agent. And in the other part, we were thinking to use sodium deoxycholate. Sodium deoxycholate is a type of bile acid. This type of bile acid has been studied because it can help for helping these tight junctions to open and to increase the paracellular pathway to absorb the monoclonal antibody. So at a glance, we were thinking to use this type of complex for both strategies. First, protection and stability of our monoclonal antibody. And second, this dual function that it could help us also the complex, not the complex per se, sorry, the counter ion to help with the paracellular pathway.
Okay. There's something very interesting you mentioned there was the enhancers themselves can protect the monoclonal antibody. Would what does it protect it from? What do you mean by that?
I mean protected by pH and enzymes normally.
Okay. Okay.
Yes. It needs protection because we don't have a lot of protease in the stomach. We have something, but it's more focused on the intestine, on the small intestine. But we have that variation that, of pH around 1, 2. And this type of complexes could give more protection. Also, we are forming the nanoparticles, and the nanoparticles are giving us protection, but we wanted to be sure that the monoclonal antibody will arrive safely to
Okay.
the epithelium, to the intestinal epithelium.
Okay.
Mhm.
So it can protect it against the pH and the
Yeah.
proteases as well. Okay.
Yeah.
That makes sense. So once you've got your particles, you know that, we've got this complex. The complex is sort of associated with our albumin nanoparticle.
Mhm.
The next step is to really test it and to see what this system can do. How did you
Mhm.
then test it for, let's say, the mucus diffusion, that being sort of one of the first barriers once you get to the site? How did you
Yes.
measure its efficacy?
So in about mucus penetration, there is a standardized protocol in our department. We use multiple particle tracking that consists, it's an ex vivo experiment. So we have mucus from pigs, mucus from the small intestine of pigs, okay? Also, we first label the nanoparticles. In this case, we use Lumogen, it's a fluorescent dye. And so we put our nanoparticles in that mucus of the pig mucus, and we incubate them for about 2 hours at 37 degrees to, I mean, to recreate the same properties and the same environment that those nanoparticles will encounter in the small intestine. And after we go to a fluorescent nanoparticle and we study the trajectories of nanoparticles. So we have to study, we study normally 300 trajectories of each nanoparticle for 30 seconds. So we create 30 frames, and those frames, there is different equations that I'm not gonna enter today because it's so boring. And so with that equation and with the because we study how they bidimensional move those nanoparticles, and we can generate how much diffusion compare also the how nanoparticles diffuse in water. We can generate that data to tell us how those nanoparticles are diffusing in the mucus. Okay, but we always need a control, so we are always comparing with our control. That
Okay.
case, for example, could be nanoparticles without the polyethylene glycol, with the polyethylene, depend on what you want. So we always compare with our controls.
Okay.
Mhm.
And how did you see? So, what was the control in this study then, when you did the
So
diffusion?
in this study, as I told you before, we use the PEG, the polyethylene glycol, as our stabilizer for the albumin nanoparticles. So in that case, our control was the nanoparticles coated without any ion pairing complex. So it was let's say plain nanoparticles coated with the polyethylene glycol. That
Okay.
was my control. Yeah. Mhm.
And then, how did it compare to the control in terms of diffusion?
So yeah, in terms of diffusion, we saw that in the case of the nanoparticles that contains the complex with sodium deoxycholate and were coated with PEG, we can increase the diffusivity in mucus. If I'm not wrong, I think 2 times.
Okay.
So it was something interesting to see because we were thinking just that probably the PEG was creating that diffusivity in mucus, but probably, as I told you before, sodium dioxycholate could have, we didn't tested this, but could maybe fluidify the mucus, or we don't know what happened in beneath, but could help also to increase that diffusivity to our nanoparticles.
Yeah, that's
Mhm.
interesting because
Yeah.
when we first started this conversation, we said, there was two mechanisms that you was aiming for: PEG for the mucus diffusion, and then the complex for the permeation enhancement. But
Yeah.
actually, what you're saying is quite
Mhm.
interestingly that the complex also has had it looks like it's had an
Yes,
effect.
it has an effect.
So the second barrier then being the epithelium.
Mhm.
How did you measure the ability of your systems to sort of improve or affect the epithelium permeation?
Mhm. So in this case, I would like to say that we ran two different studies. One was like a biodistribution study, also again with those labeled nanoparticles with the lumagen. We gave the nanoparticles orally to the rats in this case, and we study after 2 hours post administration in where those nanoparticles were accumulated in the different parts of the gastrointestinal tract. So this helped us also to know, to confirm again, not just the mucus penetrating per se properties, but also the accumulation and the arrival of our nanoparticles to the intestinal epithelium. And the second study, it was just more about promoting how we promote, or yes, it was more to confirm how we can promote the absorption of our monoclonal antibody or the nanoparticles. So in this study, we used Canorhabditis elegans. So we did an in vivo study with C. elegans, is a type of worms. The strain that we use is really specific. It's called FT63. And so these worms are labeled with green fluorescent protein in the intestinal epithelium. So the cells are dyed with GFP. So when what we evaluate was, so when you don't have any disruption of the intestinal epithelium, you can see every cell that is forming the intestine of the worms. You see it perfectly. Okay, so it's like a ladder. Let's see, you see like a proper ladder. But when the disruption in the intestine disruption occur, that perfect ladder, that color that it's high intensity, high definition, becomes blurry or fragmented. So we tested that to corroborate if our nanoparticles were having a permeating enhancing effect.
Yeah, I will put a picture up of the worms because
Oh,
it was quite a nice picture.
yeah. Hmm.
You can see they're very fluorescent and green, but
Yes.
then when you saw like slight disturbances, you can see it kind of be less green and a bit grey.
Hmm.
So I thought
Yeah.
it was quite a nice picture of that.
Hmm.
What did your formulations show? So, in terms of when you did the mucus studies, you saw that, introducing the iron complex improved
Hmm.
diffusivity through the mucus. What about when it came to sort of the permeation through the worms? What formulations did you test and what did they show?
So in this case, first we need to be sure that in this type of worms, because we know that sodium deoxycholate and sodium deoxycholate per se has this disruption. So we have two controls in this case. So we have the control per se, that it's the nematodes without treating. After a control group of sodium deoxycholate, sodium deoxysate, and after we have also a control with the nanoparticles with albumin, plain nanoparticles coated with PET, and also a group with nanoparticles containing docusate and deoxycholate, but in this case without forming the ion pairing complexes. So no monoclonal antibody, no bevacizumab in this formulation. We just encapsulate the promoting enhancers in these nanoparticles. And what we see is that it doesn't matter if the promoter enhancer is encapsulated or not. We see a significant disruption in those groups. Um, but for example, in the case of the control with nanoparticles, albumin nanoparticles coated with PEG, no promoter enhancer encapsulated, we saw that that the disruption was 2 times lower than the other groups in this
Okay.
case. So we were confirming that yes, in our nanoparticles and the free versions, we were producing a disrupting of the intestine, a disruption in the intestine.
Okay, so there was there was no, did you say there was no difference when you did use the enhancers?
No.
Okay, okay. That makes it very
Mm.
even more interesting because
Yeah.
okay, that's fine. Because
Yeah.
that's what you would have assumed that you would
Yeah.
have saw a significant.
Yeah, but we didn't. In this case, it was just disruption. I don't know if maybe with other techniques we will be able to see differences, but in this study we couldn't be able. And also this study was really nice because we didn't perform any toxicity assay per se with our formulation, but we could also evaluate the lifespan of the worms being treated and non-treated, and we see that there is no so the lifespan of the worms treated were similar to the worms not treated. So means that in this case, with the doses that we were giving to the worms, we didn't see any toxicity of the worms. They weren't dying before.
Were there any differences between the two enhancers themselves?
No, we didn't see it
Okay.
anything.
So
Mhm.
what is the size of the worms you use in terms of how many worms do you need for this to be a valid experiment?
If I'm honest, I don't know the site. Are microscopic. You can see it with your eye. But we use quite a lot, but it's so easy to culture them. I think that for each study, I remember we did it in triplicates, and I have at least 100 worms, if I'm not wrong, per group.
Okay.
Yeah,
So
but
these are,
it's quite easy to, yeah.
yeah, yeah. So these are
Mm.
micro worms. They're very, very small.
Yeah.
Okay.
Yes. Yeah. Yeah.
That makes sense because I thought in my head I was seeing like big worms or
Like
something.
no, are quite small and also are transparent.
They're
So you don't
transparent.
see it. Yes, they are transparent.
Oh, that's quite cool.
Yeah. Yeah. Yeah.
Okay.
Yeah.
I thought you had, like when you see worms in the soil. I was thinking you had
Yes.
big worms. I'm thinking,
These are soil also. They're soil worms, but are different from the ones that you can just imagine. And also, the good thing with this type of essays is that are in vivo studies, but are so fast, the cycle of the worms, that in just 1 week you can have results. So you
okay,
don't have to, I mean, to wait a lot of time. Like for example, with cells, if you wanted to consider if there is an absorption of your nanoparticles, you can just culture caco cells, but it takes you like more than 3 weeks to culture them after do your experiments. And in here, in just 1 week, you can have results.
yeah.
So it's really nice to work with them. Yeah.
That's quite
Mhm.
nice because like you say, with cells, you have to grow them for weeks on end. You have to feed them, you have to change the media, everything has to be sterile. It's just a headache, I think. Yeah.
Yeah,
Is-
yeah. In this, yeah. And for being like a preliminary study before going to in vivo with rodents, I mean, it's convenient.
When you compared it to the drug alone, which is the bevacizumab, you
Mm-hmm.
saw a quite, it depends how you look at it. So you saw a thousand-fold improvement in
Yes.
bioavailability.
Mm-hmm.
And then in the same breath, I think it was around a three, was it 3% bioavailability overall?
Yes.
If I can remember
Four, yeah,
correctly.
almost 3.7.
Four,
Yeah. Mm-hmm.
3.7. So it depends on which way you look at it because a thousand-fold improvement is a very significant
It's a lot.
improvement. But then 3.75% on its own might not be. So how do you feel about that? What was your thoughts when you sort of had that data?
I mean, we were really happy, let's say, because now there are some GLP-1 derivatives and also octreotide peptides in the market for oral administration. And those type of peptides, they have a bioavailability of 1%.
Okay,
So having with a monoclonal antibody of 155 kilodaltons a bioavailability of 3.7%, we were really lucky. But
okay.
indeed, I mean, it's something to work on it and to optimize.
If you had unlimited resources, right, and you had unlimited time with that research as to where you left off, what would you do next with it?
To study also the lymphatic transport. I see really interesting. Because we are focused on systemic absorption, and but lymphatic vasculature, it could be also important in the oral administration. And also with albumin, I would like to, I don't know, maybe in my future, I don't know if I would be an IP and I have my group, but I would like to know how albumin also could be absorbed by the, or albumin nanoparticles could be absorbed by the lymphatic transport, could be uptake by the lymphatic transport to enhance the oral absorption of monoclonal antibodies.
Okay, so you want to look at the lymphatic system in itself
Yeah,
and what role that has in absorption.
in absorption.
Okay,
Yeah, because I think that both could help us. Also, we have, yes, the strategy of increasing the paracellular pathway that I told you to open these tight junctions. But also there are papers, and the problem with using a promoting enhancers, the toxicity when you do a repeating dose. Because all our studies is in an acute dose. It was the dose that we administer was a unique dose. So I would like also to see alternatives or maybe to continue using sodium dioxycholate or some types of surfactants or promoter enhancers. But I mean, the literature tells you that this type of components are affecting the stability and the healthiness of the intestinal epithelium, but also of the macrobiota.
Okay.
Okay, so I would like to see other type of alternatives that we can use to absorb monoclonal antibodies.
That's very interesting because you're right. A lot of the work when you do in these studies is very acute. It's very short term. But
Indeed.
if a patient's having repeated doses through the epithelium, it's a very interesting way to take that into consideration because what impact does that have on the microbiome?
Yeah.
And now we're learning as well, sort of the very core value of microbiome in keeping us healthy. So what
Yeah.
impact does that have? And then what impact does it have on the healthiness of the tissue as well? So it's quite interesting. When you talk about sort of looking at lymphatic systems for absorption, how can we access the lymphatic system when we use the oral route?
There are different approaches, but also are limited.
Mm,
We have the M cells, so we have the Bayer patches that can help us that are directly, there is no mucus layer in that type of Bayer patches. The nanoparticle could be transitose. So by transitosis, it could be uptake and directly travel by the lymphatic transport. Also, there are other type of strategies that is to mimic the chylomicron pathway. So when this is with lipids, but it's not just limited to lipids, okay? But when you ingest lipids, those lipids, those triglycerides, are by the lipase, they are cut, let's say, no, and they form monoglycerides. So those monoglycerides are absorbed in the epithelial cell in the enterocyte, and they generate what we call it. There is a reesterification again, forming again triglycerides to form the chylomicrons. So chylomicrons is a type of particle that it could be nanometric or also micrometric, and what the kilomicrons do is just transport lipids to different parts of the body, let's say adipose tissue. So we can understand that pathway, the kilomicron pathway, and we can use it. But we know that also albumin, there are other two receptors that are really interesting, and the lymphatic transport plays a key role in these ones. One is the neonatal Fc receptor, that is a receptor that produces the recycling of albumin. We see that albumin, it's a huge protein for that produces the body. Is the most abundant protein in the body. It's 65 kilodaltons, and the body makes a lot of effort to produce that type of protein. So the body, it's really clever and smart and wants to recycle them. So there is a system, a recycled system, to uptake again that albumin, to put it again in the systemic circulation via the lymphatic pathway. So we can explore also that route, or also the other receptor that is the GP60, or called it normally albondin, that also produce it could uptake the albumin by transitosis. So both receptors are really interesting to also to
okay.
explore. Mhm.
That's very interesting. Very different pathways
Mhm.
that are not very commonly discussed.
Mhm.
I think a lot of the times we think of absorption, we think epithelium, through the blood vessels, but
Mhm.
it's a very unique take is looking at the lymphatic
Mhm.
system. Thank you for joining me. It's been a pleasure to have you, and I appreciate your expertise.
Thank you so much. It's been a pleasure. I enjoy a lot talking to you. It's my first time doing this type of podcast. I'm so happy, to be honest, and I enjoy a lot. Yeah, yeah, and it was really nice to discuss, wrap up all those papers, all my PhD, and yeah, it was a pleasure.